স্বাগত অপিনিয়নের আজকের এই পর্বে আমি 𝗧𝗲𝗹𝗵𝗃 আপনাদের সাথে আছি। অপিনিয়ন যেদিন যাত্রা শুরু করেছিল আমাদের লক্ষ্য ছিল একটি, তা হচ্ছে আমাদের চারপাশের ঘটমান বর্তমানের আলোকে যে প্রতিচ্ছবি আমরা দেখি সেই বাস্তবতায় একটি বিশেষজ্ঞ মতামত আপনাদের কাছে পৌঁছে দেয়া। অপিনিয়নে চমৎকার কিছু অতিথি আমরা বরাবরই আপনাদের সামনে উপস্থাপন করবার চেষ্টা করেছি, যাদের অভিজ্ঞতা, যাদের দিক নির্দেশনা আমাদের জীবনকে সহজ, আমাদের রাষ্ট্র ব্যবস্থাকে আরও সুসংহত এবং আমাদের দেশ হিসাবে, জাতি হিসাবে, মানুষ হিসাবে আরেকটু ভালো অবস্থায় নিয়ে যেতে সমর্থ হয়েছে। সেই ধারাবাহিকতা অপিনিয়নে আজকে দুজন চমৎকার অতিথি পেয়েছি, যাদের সাথে আমার যে আলোচনাটি প্রচণ্ড প্রাসঙ্গিক এই জন্যই যে কোনো দম্পতির জীবন যখন শুরু করেন একটা স্বপ্ন নিয়ে শুরু হয়। তাদের নতুন করে একে একে দুই বোনার সংসারটিতে নতুন আলোকিত একজন অতিথি আসবেন, তার উপস্থিতি জীবনকে আরও অনেক বেশি উপভোগ্য সুন্দর করে তুলবে। কিন্তু বাস্তবতা সবসময় আমাদের কল্পনার মতো হয় না। At times we dream of something that never gets true. তবে সেই বাস্তবতাকে পরিবর্তন করতে পারা দুজন অসাধারণ মানুষ আজ আমাদের সাথে আছেন। মা এবং ছেলের যুগল আমাদের সাথে, তারা দুজনই চিকিৎসক পেশায় আমাদের অতিথি হিসাবে পার্শ্ববর্তী রাষ্ট্র থেকে এসেছেন। তাদের সাথে আপনাদের পরিচয় করাতে চাই। প্রথমে ডান থেকে পরিচয় করাতে চাই, আমাদের সাথে আছেন ডক্টর 𝗔𝗯𝗃𝗁, সিনিয়র কনসালটেন্ট, 𝗖cie h Women's Hospital and Fertility Center. Welcome to the opinion.
Namaskar.
And we also have her beloved son, Dr. 𝗔𝗯𝗃𝗁, who is the consultant doctor for IVF, andrology and gynecology. Welcome as well to Opinion. First of all, ma'am, coming to you, I'm very curious about, you have been always recognized as the pioneer in infertility in all across South India. How did you start your journey is one of my own curiosity that I would love to deliver to my viewers. And also, if you could enlighten us a bit about what infertility basically is.
See, basically infertility is a situation where the couple fail to get baby. Okay, it's
Plain and simple.
Very simple. They're just not getting a baby. So you see across the world now, one out of every 6 couple, they all struggle to get pregnant. And this is a situation which is a more evolving science, where people are trying to get into the nature's secrecy and trying to get the best out of the situation and get the couple great child.
Thank you very much. Dr. Arun, first of all, I'm curious, having a mother such like Dr. 𝗔𝗯𝗃𝗁, it must be very tough becoming what you are trying to become as well, because you have always have to touch the benchmark that she have already touched. And from that perspective, as she was mentioning about infertility, can you enlighten us a bit about the woman issue and men issue into infertility separately, if you could enlighten us a bit.
Generally, if you say infertility, people think only women get issues, but it's not the case. 50% women get issues, 50% men get issues. So out of 100 couples coming to a fertility clinic or IVF clinic, 50% will have men issues and 50 will have women issues. So if you see in women, the most common would be having lesser number of eggs. Some would have PCOS, PCOD. Some would have hormonal issues. For men, if you see, they will have low sperm count or sometimes no sperms also. So these are the most common ones. Apart from that, there are some issues like tubal block. So to become pregnant naturally, both the tubes have to be open for a female. So if there is a tubal block, you can have this infertility issue.
All right. Ma'am, then that brings us to that question. When a couple should consult a fertility specialist, at what point of their married life they should consult a doctor?
It actually depends on the age of the couple. So for women, the best fertility age, if you ask me, it is from the age of 18 to 30. That's the maximum fertility potential for any woman. But because of the education, now the civilization, everything, women don't get married so early, and
you're all focusing on career.
So it's almost 30 years. They become almost when they get married. Mostly 25 plus and 30. Nowadays 30. When I started my practice in 1990, that time it was marriage age was 20, 21. Now average it has come to almost 30. So what happens, the moment they get menarche, up to the age of 20, 25, it's okay. The number of accounts are okay. After that, it starts declining. That's why after
declining with age or with the lifestyle that we are having at the food?
Age is a maximum factor. You cannot conquer the age. That is a maximum factor. In addition, maybe the lifestyle also contributes a little bit. So when they are getting married at the age of say 30 or 35, A woman who gets married at the age of 30 can have a 1 year of natural life to get pregnant. And if they're not getting pregnant after 1 year, they better consult a specialist, fertility specialist. Whereas for a woman who get married after the age of 35 years, even 6 months waiting is okay. They should consult a doctor within the 6 months, after 6 months of the married life. Moreover, that there is one more thing is that issue. It's not a question of marrying the age of the marriage. After getting married also, still women don't want to get conceived immediately. They want to have some time. They want to get established in a profession. So they want to give some holiday period. So they take 1 year or 2 years to start the journey towards a parenthood. So all matters. And I would advise now the present generation that earlier you approach a consultant, fertility specialist, you do an evaluation is always better.
Fantastic, ma'am. Then from your experience of South India or India or Bangladesh, as you have had patients from Bangladesh, what are the common issues that you have seen? Why this infertility occurs? Apart from the age, what are the common problems that you see in women having?
The most common prevalence among women you take is one of the thing is a egg issue. So the egg what matters is one of the diseases called endometriosis. The endometriosis and PCOS are two major issues which always try to put the women into a challenging position. I would say in my 35 years of journey in this fertility field, one of the commonest occurrence, very simple, is a PCOD. That is a polycystic ovarian syndrome where the egg fails to come out of the eggshell. Okay. Whereas in endometriosis, it is such a pathetic disease, I would say, and it attacks women. We don't know why, where, when. So there is some kind of inflammatory process which happens, which makes the ovary, uterus and tube all together. It causes inflammation and it doesn't allow the baby to get formed or to get settled. So, and it is cannot be stopped. Unlike PCO, which can be very easily simply dealt with, but endometriosis is a very challenging because it affects the uterus, it affects the ovary, it affects the tubal factor. If it's allowed to go, it may go even further. Okay. So there's stage 1, stage 2, stage 3. So these two are the most common things. And the next I would say is a tubal block. So some kind of infections, pelvic infections may cause some tubal block, which may not be having any symptoms. The question is
that where the whole conversation gets stopped. Like being a woman, say if I'm a woman, considering myself as a woman, I'm not getting any symptoms, or any woman who are just listening to us now, not getting any symptoms, what they should do and what they should look for.
That is the first thing. The thing is, many women who come to us, they think, I'm okay, everything is okay, still I don't have a baby. But when you start evaluating, you get to know they have some fibroids, which doesn't have symptoms. Okay, there is some tubal block, which doesn't have symptoms. So the symptomatic things is not there in fertility. Fertility issue is the only thing they'll come, we don't have. Only 20% of the women, they tell we have a pain during the periods, we have some kind of cramps and all those things, and the menses fail to come. All those things comes only in some kind of 20% of women. First, when you concern, I think he should be telling you more fact about it because they also don't have any symptoms other than any sexual issues. Otherwise, the count and motility, everything, it depends on the evaluation. Okay, so presently, the most commonest thing for both couple, I would say, 50% of couple, they come with both male factor and female factor.
Okay, let me go back to my viewers. আপনারা যারা বাড়ি বসে দেখছেন এবং শুনছেন, বন্ধুত্বর বিষয়ে আপনাদের নিশ্চয়ই সবার কম বেশি আগ্রহ রয়েছে। আগ্রহের জন্যই রয়েছে আমাদের চারপাশের কিংবা আমরা অনেকেই নীরবে এর সাথে লড়ে যাচ্ছি এবং এর পিছনের কারণগুলো হয়তো এতদিনে অনেকেরই জানা হয়েছে। এখন অনেকে প্রশ্নে ভোগেন, কেন আমি এর মধ্যে দিয়ে যাচ্ছি, কেন আমার সাথেই এমনটা হলো, এমন তো হওয়ার কথা ছিল না। ম্যাম যেমনটা করে বললেন, আমি সম্পূর্ণভাবে একজন নারী সুস্থ, তিনি কোনোভাবে উপলব্ধি করতে পারেন না। শুধুমাত্র 20% ক্ষেত্রে যেটা যে দেখা যায়, হয়তো কোনো রকম ধরনের ক্র্যাম্প, ব্যথা বা অনিয়মিত জৈবিক ক্রিয়ার যে বিষয়গুলো তিনি হয়তো পরিলক্ষিত করেন, কিন্তু তার ব্যতি রেখে 80% নারী কোনো কিছু কখনো উপলব্ধি করতে পারেন না। পুরুষের ক্ষেত্রেও কিন্তু তাই, যেমন ডক্টর অরুণ বলছিলেন। ডক্টর অরুণ, as Dr. 𝗔𝗯𝗃𝗁 was mentioning about women's whole scenario, I'll come back to men as well. As you just mentioned, 50% of infertility is because of the men factor that is involved into it. Why it is, and what are the symptoms that you see when you're treating?
Yeah, most of the men who approach us for infertility issue, they mostly have sperm issues. If you see the sperm count is too low or maybe motility is very, very low. The sperm count has to be good, the motility has to be good, but it's quite often very low. Particularly in Bangladesh men, I have seen that motility is low. So main risk factor if you see is because of smoking. Too much smoking nowadays. The number of men who smoke is very, very high one. Second is that because of their sedentary lifestyle, their sugar levels are slightly higher than normal. So when you go to a doctor, when you check up, they say sugar is borderline. So they don't give you treatment. But the sperm count and motility gets affected because of your higher sugar level. So sedentary lifestyle is the biggest risk factor. So these two has to be definitely cut down. So if you see the number of men who are suffering from infertility every year increasing, it is mainly because of smoking and sedentary lifestyle. So these two we have to somehow curtail.
Yeah, now you have scared me, because smoking is injurious. We all know about it, and it affects you in such a way that's shocking and surprising. And in that case, I don't know what to say. That brings us to a whole lot of questions, that what should be done and what should not be done. What would have been an idealistic practice? Like, as ma'am was mentioning, when a woman is getting married in 6 months, if she cannot conceive after 35, she should consult a doctor. What about men? What they should do?
So men, if they're having a normal sexual life, they need not do any checks or anything. But when they're married for more than 1 year and they're not becoming pregnant, men should do some semen analysis. Just check the sperm count and motility. That is a basic thing. If that is done, more than fine. Okay.
You said that in a simple way, but I believe the whole scenario is not that simple. Then the percent of patient that you're treating in men, what is the average sperm count that you have recognized, which is mentionable? Because I want to let my viewers know what are the percentage that they are carrying in most of the cases.
The normal sperm count is more than 15 million per ml. But nowadays, 50% men are having less than 15 million, 5 million, 2 million, 3 million. And the motility should be at least 40%. But what we see nowadays is mostly 30%, 20%, it's very low. So like I told you earlier, most of these people would have had some history of smoking or a sedentary lifestyle, obese, these kind of things. So they always have this lower count and motility. But what we should have is more than 15 million.
15 million. দর্শক আপনারা নিশ্চয়ই এর মধ্যে শুনতে পেরেছেন ডক্টর অরুণ যেটি বললেন যে লাইফস্টাইলে ধূমপান এবং সেই সাথে হঠাৎ করে মুটিয়ে যাওয়া বা যারা ওবেসিটিতে ভুগছেন এরকম অসংখ্য পুরুষ আসলে স্পামজনিত সংকটে ভোগেন, এবং যার ফলশ্রুতিতে তিনি যখন বিবাহ বন্ধনে আবদ্ধ হন সন্তান প্রাপ্তি থেকে তাকে বঞ্চিত হতে হয়। এই বিষয়গুলো খুব গুরুত্বপূর্ণ, এগুলো মাথায় রাখাটা অনেক বেশি জরুরি। সেই জায়গা থেকেই ডক্টর অরুণের কাছে আমার পরবর্তী প্রশ্নটি, ডক্টর অরুণ, দেন how does andrology fit into whole scenario, into it? How can that help?
Yeah, so you see nowadays many of the people get married very late and they work very hard. So they work in a lot of different professions, just very high work stress. So because of this anxiety and stress, their hormone levels are impacted, and their sexual life is also getting impacted nowadays. So if you see the latest studies, earlier the frequency of sexual intercourse was like 3 to 4 times per week. Nowadays it is drastically fallen. It is only once or maybe once in a month it has fallen. So the number of men who are approaching andrology specialists is increasing very considerably. And second, again, male infertility also still comes under andrology. So number of men with this sperm issues, they come to us. So the incidence of men approaching andrology specialists is increasing very much nowadays.
Is there any difference between andrology in terms of traditional gynecology? Are there any differences?
Yeah, like females, men also have many issues, andrological issues. Either it may be fertility, like sperm issues, or maybe sexual issues. So all these comes under andrology.
Okay, interesting. Ma'am, as you mentioned that nowadays women tends to get married when they're settled.
Yeah.
This age factor we cannot reverse.
Cannot.
If someone is pursuing her career and she's at a certain age when it's a risky age, I don't know if there is any risky age that you'd love to mention, what they should do and how they should deal with it.
I can say now the modern world, suppose they are having a very hardcore career and they have some more years to go and achieve the career, they have some time to get even married. Now the best option is the oocyte preservation. So oocyte preservation is one that even an unmarried lady can come to a fertility specialist and they can get the egg preserved. We can have some hormone injections, and we can take the egg from the ovaries and we can preserve it for years together. So what will happen, suppose she wants to have a baby at the age of 40 years, okay? So the egg is old, the egg becomes a old 40-year-old egg, right? Unlike men, where men produce sperms at the age of 40 years, fresh sperms are produced, but whereas women, they cannot produce eggs. The eggs are already kept there in the birth, right? So at the age of 30, 35, they feel that they will not get 3-4 years to get married. Husband is away, he is in some country doing some project work, something like that. So they can, at the age of 35 itself, they can preserve the eggs. So even when they get married at the age of 40 years, the eggs will be 35 years old.
Correct. Correct.
Right. So
fantastic. That's an amazing solution to all the crisis, and I don't know how our society will react to it, how it does react to it, but that is my point of next question. But before that, we have to take a short break. দর্শক দেখছেন অপিনিয়ন, চমৎকার একটি বিষয় নিয়ে আজ আমরা কথা বলছি, বন্ধুত্ব বা ইনফার্টিলিটি নিয়ে। আপনারা যারা মানসিকভাবে দ্বিধাগ্রস্ত, সংকটময় জীবনযাপন করছেন, অনেকের সংসার ভেঙে যাওয়ার মতো পর্যায়ে যেও সম্পর্কগুলো পৌঁছয়, অবিশ্বাস, আস্থাহীনতা, নানান রকম সংকটের মধ্যে দিয়ে আমরা যাই, তা থেকে উত্তরণের পথ নিয়ে মা ছেলের এই যুগল চিকিৎসকের সাথে আজ আমাদের কথা হচ্ছে। ছোট্ট একটা বিরতি নিচ্ছি, ফিরছি এক্ষুনি। বিরতির পর আরও একবার স্বাগত। আমি 𝗧𝗲𝗹𝗵𝘁𝘂𝘁 আপনাদের সাথে আছি। অপিনিয়ন দেখছেন আপনারা, যেখানে আজ আপনাদের প্রত্যেকের জীবনের সাথে সম্পর্কিত গুরুত্বপূর্ণ একটি বিষয় নিয়ে কথা বলছি, যা অনেকেই বলতে পারেন না, নীরবে চোখের পানি ঝরে অনেকের, অনেকগুলো সম্পর্ক ভেঙে যায়, দাম্পত্য জীবনে অস্থিরতা তৈরি হয়, অবিশ্বাস তৈরি হয়, আস্থাহীনতা তৈরি হয়, এবং দিন শেষে হতাশা আমাদের এমনভাবে গ্রাস করে যেন এ থেকে উত্তরণের কোনো পথ আমাদের মাঝে নেই। বন্ধুত্বের কথা বলছি বা ইনফার্টিলিটির কথা বলছি, যা এখন খুবই পরিচিত একটি শব্দ আমাদের সাথে, যা আমাদের প্রত্যেকের জীবনকে কোনো না কোনোভাবে প্রভাবিত করে। এই বিষয়ে কথা বলতে মা ছেলে যুগল চিকিৎসক আমাদের মাঝে উপস্থিত আছেন। আরেকবার মনে করতে চাই, আমাদের সাথে আছেন ডক্টর 𝗧𝗲𝗹𝗵𝘁𝗂, হু ইজ এ সিনিয়র কনসালটেন্ট, 𝗖𝗫𝗵𝗵𝘁𝗂 Women's Hospital and Fertility Center. Also, we have Dr. 𝗖𝗫𝗵𝗁𝗁, who is the consultant doctor of IVF and andrology and gynecology. Ma'am, coming back to you again, can this happen? Like, I'm having my first baby and I'm being healthy and fertile. Can infertility occur for the second baby, second issue? Is there a chance like that?
yeah, it can happen. Can happen. Most of the people we see, they get first child on their own without any help, and when trying to get a second child, they may give a gap of few years, and after that the body changes, the lifestyle changes. So there are people, almost we come across 10% couple who are coming to the fertility center now. They are wanting to have a second baby or third baby because something happens, like obesity, lifestyle changes, and the changes in the hormonal situations, all those things, stress of life, everything. So the motility or the sperm count can come down for men, and women, they can also get some fibroids in between or endometriosis, something which prevents the natural conception.
Okay, then we are never safe. Safe is never safe. Fertile is never fertile always, and infertile is not fertile. We'll go on that on the later part. But then again, ma'am, this brings us to a question like 𝗖𝗫𝗵𝗵𝘁𝗂𝘁 Fertility Center, and it's been known for its advanced treatment. Could you elaborate on the range of fertility treatment that it offers, like basic, advanced, or such as IUI, IVF, and ICSI?
Yeah. So start with, it's 𝗖𝗫𝗵𝗵𝘁𝗂𝘁 Fertility Center. It's very well known for, and we are almost more than 30 years of a professional experience in this field of fertility. And I would say that first, the most important thing is the basic thing is the evaluation of a couple with investigations like scan and blood tests and some tests, all those things. It starts with the counseling and it starts with the investigations, the evaluation. After evaluating a couple, both male and female, and we come to a conclusion, what could be the factor? What is the reason for the not getting a baby? So depending on that thing, we like to place a thing like that. We start with a simple, very basic thing like a ovulation. That is like giving some medicines, tablets, and putting the female into making eggs, and you see the scan that the follicle ruptures, and you ask the women to have a contact with the husband, sexual contact. This is a very basic, very simple, right? It applies to some couple who have got all parameters okay, and still we want to try. The most important and the most very simplest thing I would say for a natural conception is the IUI. That's the intrauterine insemination. Husband semen and the wife has to be, inseminated with a prepared semen, everything. So how it does improve the fertility? Okay, how it gives a solution? Because the ovulation date and time, even the women try to follow with all the apps and all those things. Doing an ultrasound scan gives a clarity of when the follicle is going to rupture, when the egg is going to get released. Once the egg is getting released, they cannot live more than 24 hours. Okay, unlike the sperm, which can live
72 hours.
72 hours in the body, human body. So the timing of the ovulation is the most important thing.
Correct.
And that time we try to take the semen and prepare the semen. We remove all the debris, everything, and take the very live motile sperms in a small fluid and just put it across the uterus.
Sounds very simple.
Very simple, very simple. It's very simple. The thing is, it improves the natural fertility, I would say. But unfortunately, all women doesn't get pregnant by IUI treatment. So next stage is the test tube baby. We call it, simple word is a test tube baby, which involves IVF and 𝗥𝗶𝗃, all the procedures. And IVF is almost you put the egg and sperm into a dish and allow it to select by itself. Which sperm has to go to the egg by, it's a natural selection. Whereas in 𝗥𝗶𝗃, now it's the most advanced thing and the most wanted thing. Why? Because the 𝗥𝗶 doesn't demand a very high count of the husband. Even a husband who has 10 sperms, 15 sperms, or 5 sperms, or even no sperm, I think he should be able to elaborate more about the 𝗔𝗲 part, where there is no sperm coming out, but still there has a sperm inside the testis, so it can be taken out, and that also gives a positive pregnancy because the sperms are getting injected in the egg directly by in the lab. Still more advanced is the most advanced, and 𝗖𝗿𝗄𝗃 is very famous, I would say, for the last almost more than 8-9 years. The PGT. What is called PGT is a pre-implantation diagnosis of the embryo.
And how does that takes place?
It is like same 𝗥𝗶𝗃 process. You make the embryo. So embryo forms and you grow the embryo to 4 to 5 days in the lab. On the day of 5th day, previously after a few years back, what we are doing is take one cell of the embryo, each and every embryo, and you send for the genetic analysis. How healthy is the embryo? Because you need 46 chromosomes, either female XX or male XY. But there are so many genetic diseases which is occurring. So even the lady who is trying to get pregnant at the age of 40 years, and there is a high chance of going for Down syndrome, okay, which gives a lot of agony to the family and child. So to prevent all those things, to get a healthy baby, okay, healthy baby. So this plays a very high role. Now latest, what is latest in the PGT is, instead of taking a biopsy of the cell, we take the fluid. Okay, the fluid around the embryo itself can give you a diagnosis whether the embryo is healthy or not. So not touching the embryo, not trying to take it. So this gives us still more. It's a non-invasive. So it's still more very good, and it gives a great
result. Lovely.
So
let me translate it for my viewers, because that's very important. আমরা এরই মধ্যে জানি যে বন্ধ্যত্ব প্রতিরোধের জন্য নানান রকম উপায় এসেছে। আইইউর কথা বলছিলাম আমরা, আইভিএফ এর কথা বলছিলাম, 𝗥𝗶𝗃 কথা ম্যাম বললেন। যেই হাসপাতালে তিনি কর্মরত রয়েছেন, 𝗖𝗄𝗃 ওমেন্স হসপিটাল অ্যান্ড ফার্টিলিটি সেন্টার, এখানে তারা পিজিটি নামক একটি প্রক্রিয়া অবলম্বন করেন, যেখানে নিশ্চিতভাবে সিলেক্টিভ ফার্টিলাইজেশনের পাশাপাশি এই বিষয়টি নিশ্চিত করা যায় যে বিষয়টি যেই সন্তানটি কনসিভ করবেন শারীরিকভাবে কতটা সুস্থ থাকছে। কারেক্ট ম্যাম? ইফ আই এম গিভিং এ প্রপার ট্রান্সলেশন টু ইট, নট অনলি দ্যাট, এবং এই পুরো প্রক্রিয়ার মাধ্যমে যেই সন্তান ধারণের যে প্রক্রিয়া, যে আসন্ন যে নবাগত শিশু, তার এমব্রিওর কোনো ধরনের ক্ষতি হয় না, কারণ ফ্লুইড থেকে এই বিষয়টি জেনে নেওয়া যায় কতখানি সুস্থ বাচ্চা আসলে গর্ভে ধারণ করার সুযোগ তৈরি হয়েছে। ম্যাম প্লিজ, ইউ আর মেনশনিং।
So I would proudly say the 𝗖𝗄𝗃 Fertility Center in Chennai, because we have 70 centers across India, and we are one of the largest network of fertility centers. The most famous Chennai, our center, where Dr. Arun Muthuvel, he is prime person, he is a consultant sitting there, and the problem is people need not be worrying about all these things. We take care of all the part of this. So the PGT plays a very important role. Now, what does happen? These are the things which, when people have egg and sperm. Suppose people don't have egg. By birth itself, the ovary is not functioning. Or somehow the eggs gets exhausted. Or they are not able to have a quality egg. Or there is some genetic problem which cannot be cured. So still they can go for a egg donors.
Okay.
Which is the next stage, which can occur to some people, very few people, not I can say everybody, very few people.
In percentage, how much percent that would be?
Maybe at the age of 35 to 40 years, maybe 5 to 10% of people, they may require. Because they are born without ovaries, they are born having premature ovarian failure, they need to have. So, and also we can go for a surrogacy. Right now there is a lot of legal limitations in this application of the surrogacy, where the women doesn't have a womb, or the womb is very weak. They could not have it conceive. They could not have the baby for 9 months. So these are the things which going.
These are the things that have been taking place. That brings us to Dr. Arun. Ma'am was mentioning what are the protocols, procedures, standards that we do have. Can you enlighten us a bit about what we have achieved in the last 12 years? Because this has become a word of mouth recent days, like for the last 5-6 years, and we have been fighting about, the doctors have been fighting with it for the last more than a decade. What are the advancement that we have achieved in Aishwarya, what you have achieved?
So earlier it was only mostly like Madam said, mostly ovulation induction IUI. So once the IVF came now, it has become popular, and after the 𝗥𝗶𝗃𝗁 came, in IVF earlier only normal sperm count can be used for IVF.
Correct.
Because they used to take sperm, they used to take egg and put it in a test tube.
Correct.
Now after 𝗥𝗶, what happened is that people with very, very low sperm count, like men with very low sperm count, even if they have 10 sperms or 15 sperms, we select the best sperms and inject into the egg of the female. And we allow it to fertilize, and it grows in the incubator for 4 or 5 days, and then we transfer it to the womb. So that is the thing. Earlier it was happening. Now in the last 7 to 8 years, what's happening is frozen embryo transfer. So we don't put the embryo back into the uterus immediately. We freeze it, it is preserved. So giving a gap of 1 or 2 months or 3 months, we transfer the embryo into the uterus. So it's called frozen embryo transfer. So now in most places in the world, everybody has switched from fresh transfer to frozen transfer. That is one.
How does that help?
Because in a stimulated IVF cycle, you put injections for the women. So the hormone levels go higher.
Correct.
So the chance of becoming pregnant goes low. Whereas in a frozen transfer, there is no hormone injections given. So the chance of becoming pregnant is higher. This is one. Wow. And the other most important one is there are men with 0 sperm count. There is no sperm at all. In those cases, we put a needle in the testis. We take tissue, check for sperms in the microscope. Almost 80% get sperms. Those sperms are injected into the egg. So that is the latest one. And even with men who underwent this 𝗖𝗲𝗹 procedure to get sperms, sometimes they don't get sperms. 20% don't get sperms. Where we have gone for an advanced procedure called micro TC, where we use large microscopes. We open the testis, check for specific exact places where sperms are there in microscope, and take those tissues and send it to the IVF lab for checking sperms. So a lot of advancements are coming in the last 6 years particularly.
Fantastic too. আমার দর্শকদের বলতে চাই, একটা সময় এমন ছিল যে নিঃসন্তান দম্পতিদের জীবন আলোই নিভে যেত, কোনো সুযোগই তারা পেতেন না। এরপরে ধারাবাহিকভাবে যেমনটা ডক্টর অরুণ বলছিলেন, আইভিএফ আসলো। আইভিএফ হয়তো সুস্থভাবে একটা পথ আমাদের খুঁজে বের করে দিচ্ছিল, যেখানে অনেক স্পার্ম কাউন্ট থাকতো, স্বামীর দেহ থেকে তা নিয়ে স্ত্রীর মাঝে কোনো না কোনোভাবে স্থাপন করে দেয়া হতো বৈজ্ঞানিক উপায়ে। তার পরবর্তীতে আইইউআই আসলো, তার পরবর্তীতে 𝗥𝗶 আসলো, এখন পিজিটির কথা বলছিলেন, এবং এতখানি অ্যাডভান্স হয়েছে যে এমন যদি কোনো পুরুষ থেকে থাকেন তার কোনোভাবে দেহে স্পার্ম প্রডিউস হচ্ছে না। প্রযুক্তির সক্ষমতা এমন একটা পর্যায়ে পৌঁছেছে, এবং ঐশ্বরিয়া তারা এমন একটা পর্যায়ে নিয়ে গেছেন যে টেস্টিকলস থেকে খুঁজে বের করার, অন্ডকোষ থেকে খুঁজে বের করার সুযোগ তৈরি হয়েছে যে স্পার্ম আছে কিনা, এবং সেই স্পার্ম দিয়ে ফার্টাইল এমব্রিও তৈরি করার। কি অসাধারণ এই উদ্যোগ! তাই যারা ভাবছেন, দুশ্চিন্তাগ্রস্ত রয়েছেন, তাদের জীবনে তো একটা বিশাল সম্ভাবনার দ্বার উন্মোচিত হয়েছে ঐশ্বরিয়া। এই বিষয় নিয়ে আমরা একটু কথা বলতে চাই, তবে আরেকটা বিরতির সময় আমাদের হয়েছে। স্বাগত আরেকবার অপিনিয়ন দেখছেন আপনারা, 𝗧𝗲𝗹𝗵𝘁𝗀 আপনাদের সাথে আছি। নিঃসন্তান দম্পতিদের জন্য আজকের এই দিনটি সত্যি আশীর্বাদের মতো, কারণ আজকের এই আলোচনার মাধ্যমে জীবনের ওই একটি লক্ষ্য, একটি সন্তানের যেই তাড়না আপনাকে তাড়িত করে যাচ্ছে, তার হয়তো একটি আলোর রাস্তা আমরা দেখাতে পারবো। ঐশ্বরিয়ার দুজন চিকিৎসক আমাদের সাথে আছেন, মা এবং ছেলের যুগল, যারা নিঃসন্তান এই দম্পতিদের জন্য একরকম আশীর্বাদ হয়ে এসছেন। জীবনের এই সংকটটাকে সৃষ্টিকর্তার মাধ্যমে কি করে চমৎকারভাবে একটা সমাধানের দিকে এগিয়ে দিতে হয় বিজ্ঞানকে সাথে রেখে, তাই তারা বলছিলেন। ডক্টর অরুণ, coming to you, if you could just share with us about the steps of IVF, and if someone wants to reach 𝗖𝗵𝗴𝗵𝘁, how they should approach and reach.
Yeah. So if you see what is IVF? IVF is nothing but fusion of egg and sperm in a laboratory condition instead of in a human body. So every woman gets one egg released every month. So now we need more eggs for better IVF success. So we use hormone injections to stimulate the ovary to produce more eggs. So once the eggs are produced, it's collected using a small needle, and then husband provides sperm. So the egg and sperm fusion happens in a process called 𝗥𝗶𝗴𝗵𝘁, like I told you. Once that is done, the embryo develops in next 4 or 5 days. Those embryos are frozen. Once they are frozen, we give a gap of 1 month, 2 months for the ladies to take some rest.
So the injection that you have given, that gets neutralized.
Correct. So once a woman takes a break of 1 or 2 months, those embryos which are frozen are taken and transferred back into the womb of the female.
Does it affect anyway the embryo quality and anything?
No, not at all. Not at all. The survival rate of embryos are close to 100%. So there is no issue of survival here. So the embryos get survived, and we transfer back into the uterus. Once the embryos are transferred back, you need to wait for 2 weeks, 14-15 days, and you can check a pregnancy test through blood. It's called beta-HCG. We check and see whether the treatment has succeeded or not. So whether she is pregnant or not, those can be done. So broadly, if you see, first month to collect the eggs, 1 month to take a break, and 3rd month we do the embryo transfer. So the entire treatment can be completed. And we are there in all social media platforms, YouTube, Instagram, Facebook, everywhere. So if any couple wants to contact us, they just have to put a message there, and we will respond. We have coordinators who speak Bengali, and they respond. They take care of all those aspects. So it's easy to communicate with us.
Then what is the range of expenses that I might be looking forward to?
For a simple IVF, if a woman doesn't have any issue, any major issue which needs surgery or anything, they want to do only IVF. In terms of taka, if you see, it comes close to 4 to 6 lakh taka. The complete IVF treatment. If they have any fibroid surgery, anything, that will be separate.
Different addition. To দর্শকদের আমরা বলতে চাই, একটা সময় আইভিএফ এর কথা যেমনটা আমরা করে বলছিলাম, আইভিএফ এর সাথে 𝗥𝗶𝗴𝗵𝗃 একটা সম্মেলন এখানে ঘটানো হয়েছে, যেটা আসলে তারা প্র্যাকটিস করেন, যেখানে একজন নারীর দেহে হয়তো যেহেতু প্রতি মাসে একটি মাত্র এগ উৎপন্ন হয়, তাতে করে তারা ইনজেক্ট করবার মাধ্যমে এগের পরিমাণ বাড়ান, সেই এগগুলো মাইক্রোস্কোপ দিয়ে কালেক্ট করে একটা ফার্টাইল অবস্থায় নিয়ে যাওয়ার চেষ্টা করেন। শুক্রাণুর সাথে মেলবন্ধনের পরে এমব্রিও যেই তৈরিটা হয়, সেই এমব্রিওটাকে তারা ফ্রোজেন করে রাখেন, কারণ যেহেতু নারী দেহে একটা ইনজেকশন দেওয়া হয়েছে হরমোন বৃদ্ধি করবার জন্য, হয়তো সেই মুহূর্তে একটা সফল কনসিভ নাও হতে পারে পুরো বিষয়টিকে, তাই তারা একটা নির্দিষ্ট সময়ের গ্যাপ দেন, 1 মাসের মতো এমব্রিওটাকে ফ্রোজেন করে রাখেন, সেই এমব্রিওকে পুনরায় মাতৃদেহে স্থাপন করে দেন। আমার জিজ্ঞাসা ছিল যে কোনোভাবে এমব্রিওর যে কোয়ালিটি আছে তা কোয়ালিটিতে প্রভাব ফেলে কিনা। ডক্টর অরুণ যেটা বললেন, কোনোই প্রভাব ফেলে না এবং শতভাগ সফলতার সম্ভাবনা তৈরি হয়, যা হয়তো মাস 3 পরে একটি রক্ত পরীক্ষার মাধ্যমে একজন নারী নিশ্চিত হতে পারেন তার যে কাঙ্ক্ষিত সন্তান তার গর্ভে ধারণ তার সফলভাবে সম্পন্ন হয়েছে কিনা। ডক্টর চন্দ্ররেখা, as Dr. Arun was mentioning, that brings us to a point of surgery. There are lots of surgeries that's been involved. There is laparoscopy and other surgeries involved. If you could tell us a bit about it.
See, actually in fertility, there is both laparoscopy and hysteroscopy, which is involving the fertility enhancement surgeries. That's called fertility enhancement surgeries. So it's almost starting with the diagnostic, like you have a diagnostic laparoscopy where you try to, there is some percentage of unexplained couple fertility issues. You do everything is normal looking, but still they don't conceive. So basically, when you put the laparoscopy inside, you can visualize the uterus, tubes, and ovaries, everything. You can find out any endometriosis there, all those things. It's called a diagnostic laparoscopy. Same way, before keeping the embryo, before the frozen embryo transfer, we like to see the cavity, uterine cavity.
If it is enough for conceiving a baby.
For conceiving baby, how good it is, how safe it is. That's called diagnostic hysteroscopy. So there is a diagnostic laparoscopy, there is a diagnostic hysteroscopy. Now they have an issue. Say somebody is having fibroids. Okay, fibroids is a mass in the uterus. It's a tissue mass which is happening in the uterus. So it disturbs. It doesn't allow the baby to grow. Okay, in that case it has to be removed. So this laparoscopy gives a boon to such women. So it is instantaneously we remove the fibroid, which takes only few minutes, and it's like a daycare surgery, and it doesn't involve too much of thing. They can go back to work in a day or two. Similarly, the tubal block. There are cases you have a tubal block, they want to conceive naturally, and you try to remove the tubal block with the cannulation. That also helps some couple, and it's very easy. There are couples who have IVF already taken IVF and they have repeated IVF failures. They don't know what is the reason. In that case, you put the laparoscopy and see there is a tubal bulge, 𝗲𝗲𝗃𝗂𝘁𝗃 they call, tubal bulge with a fluid in the tubal cavity which doesn't allow the embryo to grow. So we do a clipping, that's called clipping, which it improves the success rate of IVF.
Wow.
So that's also one thing. It just takes only few minutes. And there are something where it's called pyrosalpinx, where you have a very damaged big thing, you can remove the tube. And most of the people, sometimes they have a endometriosis. Endometriosis, it needs, in addition to medicine, it needs sometimes a surgery where you can remove the adhesions and try to give the best environment to the baby to get settled in. And there are people who have a big cyst in the ovary. Even 5 to 10 centimeter cysts are there, which gives lot of pain and they cannot go for work. Such people, we remove the cyst. So that's a very good thing which improves the fertility. And sometimes naturally some women are born with a septum in the uterine cavity. They have a septum, some tissue hanging. It divides the cavity in 2 portions. Some have very small septum, subseptum we call. Some have a very big septum we call complete septum. Even last month from Bangladesh, one couple came and they have a very big septum. The whole cavity is divided into 2. Very young couple only. And this was taken now, like 10 minutes, we removed the septum in the hysteroscopy and the patient was back to Bangladesh after 2 days. So that means we are bringing her to almost natural.
Correct.
Even though there is some deformity, we bring to natural.
You make that so simple, this whole complex thing, you made it so simple with your words and with your smile. I must appreciate that. And I don't know how to put my words into your beautiful smile when you make things so comfortable for everyone. So say if an infertile couple comes to you, what did they go through lots of social pressure and taboo? They go through lots of family pressure as well. And how do you basically consult and support the patients? I believe your smile plays a big role into it. And apart from that, how do you consult them?
The whole concept of universe is love and the generations. Okay, what you create and what you leave behind your own, the gene, what you leave behind. So when a couple with lot of love and respect, they want to create their own family and they're denied, they're not getting it. It's a most frustrating and devastating emotional status.
Correct.
And it gives lot of problems in their relationship. And the social stigma is very, very high because the elder generation, they fail to understand how difficult the younger generation is facing such issues. And many are even against the treatment and all those days. Luckily nowadays people are, they know everything, they accept this IVF treatment is accepted. I can say 25 years back when we started IVF, there are people who are talking about confusing the religion and the fertility treatment.
Correct.
Nowadays luckily all gone. Everybody is accepting this as one of the standard
social
treatment.
Norm.
Social, yeah, its acceptance is very good. And I feel that 𝗖𝗄𝗄𝗃 supports every way to a couple. And we are very passionate and we are very compassionate towards the things. And everybody should need emotional support and social support. And I will say, it's definitely you can win the race.
With time and patience.
With time and patience. And put up all your thing. This is a challenge, but it's not something which is impossible. It is a possibility is there.
Thank you
so
very much,
go happily, don't strain yourself. No infighting between the husband and wife of when it happens, when you are expecting doesn't happen. Be bold, stay together, you will win the world.
Thank you very much. She's an amazing speaker, I must say. She could have taken my profession sitting here and asking questions. Dr. Arun, where we stand now is about the men. How do you address the emotional toll on a man who's struggling with infertility, and also the ethical boundaries guide to modern reproductive technologies that we have?
See, for men, so people always think about women in infertility, but actually there are men who
suffer. We are responsible.
Yeah,
we are halfway responsible.
We cause half the problems. So men also need to check their sperm count. If they see that the count is low and they're not getting married, then better preserve the sperm, freeze it and preserve it for some time. That is one. And second is
how long sperms can be preserved?
100 years, as long as you want.
Okay.
And one more thing is that men should also lead a very healthy lifestyle. You should You should reduce your food intake, reduce weight, be fit, do more exercise, walking, all those things. Men should also be in fit thing. People always think women should be fit, but men also should be fit. That's the most important thing. And again, men should also try to get married at the earlier age. Nowadays, no, the age of marriage has gone almost 38, 37 in most developed countries. So I think men also should be very proactive in creating next generation. That's the most important one.
Lovely. There are some myths where I would love to have a recap of the whole discussion we have. There are some myths that we would love to bust out today. One is infertility is always in a woman. It's a woman's fault. IVF babies are not normal. Once infertile, always infertile. Answers in 1 or 2 words.
Yeah. See, actually, people think that once infertile, always infertile. It's not the case. I have seen so many couples who have done IVF for the first pregnancy. Second baby, third baby, they conceive naturally. So many people are there, countless number of people. And again, what was thing? So men and female, they get equally affected. It's not always the female partner. And what else?
Infertile, always infertile. Not
the case.
Not the case. And babies are not normal IVF.
Babies are perfectly normal like a natural baby. The only thing what we do different in IVF is that the fusion happens in the laboratory, nothing else.
Lovely. Ma'am, is fertility treatment only for wealthy, and are there any affordable programs for the low-income couple in 𝗖𝗺𝗃? There are?
𝗖𝗺𝗃, it stands and was created, it was founded that no woman, no couple should suffer for want of child. And it offers everybody and it supports everybody, rich or poor, everybody deserves joy of parenting.
Lovely.
So we support them in every way.
Lovely. Ma'am, one last question. In a crucially or in a culturally sensitive country like Bangladesh, how do you navigate religious or social values of IVF in small words?
I now come across like nobody is afraid of getting IVF treatment. Take it any religion, anywhere in the world, any geographical society, all are prepared to accept this. And people read a lot, and we have a lot of YouTube programs, lot of things in our Insta and Facebook. And I think everybody is given a due choice, will like to have a baby.
Lovely. Ma'am, one suggestion from both of you. What should be an ideal age to get married?
For female, it should be ideally less than 25.
Less than 25?
For male, it's less than 30.
Ma'am and sir, thank you very much for joining me here today. I would love to end this conversation with a smile, because this has enlightened lots of hope in our heart and in a lot of couples. দর্শক, সকল নিঃসন্তান দম্পতি যারা তাদের জীবনে একটি অন্ধকারাচ্ছন্ন সময় পার করছেন, একটি সন্তানের জন্য অনেক লম্বা সময় অপেক্ষা করছেন, তাদের জন্য আসলে একটি আশীর্বাদ হিসেবে এসছে। মা ছেলে যুগল চিকিৎসক যে অসাধারণভাবে সহজ করে বুঝিয়ে দেওয়ার চেষ্টা করলেন, তা শুধুমাত্র আপনার একটি ক্লিকের অপেক্ষায়। আপনি ক্লিক করেই সামাজিক যোগাযোগ মাধ্যম কিংবা ডিজিটাল মাধ্যমে তাদের খুঁজে নিতে পারেন, যেখান থেকে আপনাদের জীবনের পরিবর্তনের সেই আলো খুব সহসাই হয়তো আপনাদের এসে ধরা দিবে। 𝗧𝗲𝗹𝗵𝗃 আজ এখানেই বিদায় নিচ্ছি। ভালো থাকবেন সবাই, সুস্থ থাকবেন সবাই, যুক্ত থাকবেন যমুনা টেলিভিশনের সঙ্গে।